So we are ready? Thank you for being here. Good afternoon. I am KP George, Fort Bend County Judge. Today, we are here to give you an update on our efforts in Fort Bend County to assure that our residents are informed of the most recent information surrounding the increase in COVID-19 cases in our county. And as you know, it is throughout the country happening. The effort that we, the people you see behind me, and are putting in place to make sure that Fort Bend County residents continue to have access to COVID-19 vaccine so they can protect themselves, their families, neighbors from contracting this dangerous virus. And it is important that I have joined by today, the people behind me, especially our Health and Human Services Director, Dr. Jacqueline Minter, Tony Sharp. Tony here? No. Oh, Tony's not joined. J.T. Pena, Brian Petrella, Scott. Scott is here? Okay. And of course, Ben is not here either, right? Ben? Okay. And of course, Alan from our Office of Emergency Management, and others to discuss what we are doing in Fort Bend County. Because as you know, from day one in Fort Bend County, we relied on science, data, and also experts to make sure we are doing everything possibly to combat this dangerous enemy of the century. And that's the reason why we were able to, when it comes to testing in the beginning, we were able to test maximum people. We are still in the top 5 or so. And then when it comes to vaccine administration, we are really took that seriously. We did take that seriously. The people behind me, as a team, we all work together. And that is the reason why we are so far doing exceptionally well when it comes to vaccine. And 65 and up age population, 96% in Fort Bend County have at least one vaccine, and 88% is fully vaccinated. I believe that is a great accomplishment. And 12 and up, 74% got at least one vaccine, and 66% of Fort Bend County is fully vaccinated. And so now, as you all know, we wanted to protect our citizens especially from this new variant transmitting virus, especially to those who are not vaccinated. And we talked the details. Obviously, we are joined by numerous experts, in their field. And I just wanted to invite, Fort Bend County Health and Human Services Director, Dr. Jacqueline Minter, to give an update on our status, COVID-19 status in Fort Bend County. Dr. Minter?
Thank you, Judge George. And good afternoon, everyone. Exactly 1 month ago, this week, actually today, we received confirmation of the presence of the Delta variant of SARS-CoV-2 virus in Fort Bend County. We received laboratory results for 5 residents who tested in prior weeks. We completed those investigations and announced the confirmations within 24 hours of notification. Along with that announcement, we reminded our residents that the Delta variant was present in the community before this confirmation. Obviously, it had to have been because they tested before. Because of the knowledge of the Delta variant's effect in other countries across the globe, we could anticipate the effect it might have on our community. This provided us with a wonderful opportunity to underscore the importance of getting vaccinated and remembering that both doses are needed when receiving the Pfizer or Moderna vaccines, and the importance of wearing masks and maintaining physical distance from others when you're in public spaces for those who aren't fully vaccinated. Well, since that announcement, we've been able to further quantify the results of the Delta variant, increasing in viral activity with increased test positivity, increasing cases, increasing hospitalizations, and that includes ICU admissions. And of the variant cases reported to the Fort Bend County Health Department this week, or in the past week, 77% were of the Delta lineage. The vast majority of the severe illnesses have been in unvaccinated people. We are finding that this variant is especially adept at spreading in close groups of unvaccinated people. And although it appears that our vaccines are holding up very well, while transmission rates are low, as the transmission rates increase, especially with this contagious variant, new data will learn whether they still hold up or whether they might not be quite as protective with the higher transmission rates. Our community has benefited from a population willing to be vaccinated and provide protection for themselves and others. However, we've got to consider our neighbors and children for whom vaccination is not an option. We also have friends and family that have health conditions that don't allow them to receive the full protection even when they are vaccinated. Wearing face coverings when we are unable to maintain safe spaces will help prevent the spread of this highly contagious variant. Clearly, we're not free from the effects of this virus. As new data is provided, we will inform the community as early as possible so people can make decisions and take steps to protect themselves. And in the coming months, as I've said before, we're likely to see fluctuations in cases as new variants emerge. The characteristics of these variants, how fast they spread, what populations they affect, and how well our vaccines will work against them will determine future actions that we have to take to protect ourselves. In the meantime, wearing our masks and remembering the easy-to-follow steps of physical distancing and washing our hands will help us maintain the collective health and well-being of our community.
Thank you. Thank you, Dr. Minter. COVID vaccine continue to be our best bet to the way out of this pandemic, and we still have many in our communities not protected with this vaccine. A rapid spread of Delta variant is putting entire community in jeopardy. We have to take action now to slow rapid spread of Delta variant. It is twice as contagious as original COVID-19 vaccine, as you all know. And masking has been proven to significantly reduce the spread of COVID-19. To help protect yourself and other residents, your neighbors, your family, should be vigilant you have to be vigilant and wear mask indoors. And that's why, it is proven. And it is, there is no need to fight these mask and vaccine and things of that nature. And when you are with people other than your family members, please wear mask. And it is highly recommended wearing mask while you are indoor, asking everyone to wear a mask indoor when in county facilities. This is a preventative action that is being asked. This is not, I will repeat, this is not a mandate, but it is strongly advised to reduce the number of infected people. To talk more about this, I will invite our county's risk management and loss control and safety specialist, J.T. Pena.
Good afternoon. Just like the judge says, we just want to reiterate for everybody to protect themselves. There's going to be seeing signs go up throughout the county for our patrons and our employees where the mask is going to be recommended indoors to protect yourself, your family, and the people around you and your neighbors. Just like the judge says, we just want everybody to protect themselves to the best of their abilities and give them the tools and the reminders that they need. Thank you.
Thank you, JT. And I just wanted to let people know that last week I went to visit my 89-year-old mom, and I didn't see her for 2 years. And I wanted to visit a lot of family. Originally, I am from New York, and so I wasn't able to visit our other family members, because a number of people are sick with COVID Delta variant, and they are vaccinated. And the beautiful thing about that infection, beautiful thing about that is they're okay. And because they're vaccinated, and they're okay. And also, I just read yesterday, Texas Tribune reported since February, Texas lost around 8,787 Texans we lost to COVID-19. Out of that, 43 people, only 43 people were vaccinated. Rest, all of them. That gives you more than 99.5% of the people we lost was not vaccinated. Please, people, and vaccine is here, and vaccine is going to protect you. Please get vaccinated, and this has continued to be a problem all over the country. And the fact is, here we know the fact, and the science is available. COVID is not gone. And we all wanted to get back to normal, and we are almost back to normal. And we wanted to keep it that way. That's why we are taking these precautionary measures so that we could keep Fort Bend County continue to thrive. And as you all know, I mean, when it comes to one of the success, most of our businesses getting back to normal, and people are getting back to their regaining some of the normalcy in their life simply because we were able to vaccinate the maximum number of people. But when you have around 860,000 people, and even 25-30% of the people, it's a lot of people out there. And so my request to our residents, please go and get vaccinated if you are not vaccinated. And if you are vaccinated, tell your story and tell your neighbor, your family member, those who don't want to get vaccinated or vaccine hesitancy or things of that nature. Tell them so that we have an understanding and we can spread that good word so that we could save lives. And so we all know it. It is, and we all know that. We talk about the community protection, or we call it herd immunity, and we are still not there. And so let's all work together. And so I wanted to also bring up, I will bring back Dr. Minter to talk about the preparation and how the vaccine situation, the vaccine locations and the preparation, how we are making sure everyone who wanted to get vaccinated, there is no more registration, there is no more waiting, and you could walk in and get vaccinated, and as you all know, it is a free vaccination. Dr. Minter, can you give some information about how our vaccine locations are operating and what people need to know about it?
Sure.
Please.
Thank you. So yes, thank you, Judge George. Our vaccine locations continue to be open. We're open Wednesday through Saturday at our fixed locations. We're open from 11 to 7, so that gives people who are working some time to get off work and come and get vaccines. We also have multiple locations with our mobile unit. Every Saturday, Sunday, and Monday, our mobile unit is in different places in different precincts throughout the county. And then by request, we are doing different community organizations, homeowners organizations, working with nonprofits at times and places that are convenient to the public.
Thank you, Dr. Minter, and we will continue to work together with our community leaders, of course, these people you see me behind me, and our community partners, nonprofit religious organization. We work very closely with our religious organization, our religious entities to, get into the community more and just spread. When we wanted to send information, we worked with them very closely. We will continue to do that. And other municipal leaders, elected officials, this is not a one-person or two-person effort, and we will continue to work with these stakeholders to combat this dangerous virus. And also, I just wanted to say, we have seen a spike in numbers when it comes to young adults getting infected from COVID-19 vaccine. And also we need, I repeat this, if you are vaccinated, tell your story to others. Put them at ease so that they will go get vaccinated. Provide information, and and that's the reason. That's one thing I will say. And also we all know that the vaccines are safe, effective, and life-saving. And as far as county's standpoint is concerned, definitely we will continue to do this effort, and we are actually working with certain organizations to find out and learn and understand about the vaccine hesitancy. And we are here to learn. We are here to learn. And we have noticed the people of color, economically disadvantaged, and people of that nature, they are the one always get left behind. And we wanted to reach out to them. We wanted to provide them with information so that they could make their decision what is best for them. And we wanted to make sure they get the information, and that's what we are trying to do. Remember, protect yourself, protect your family, protect your neighbor, stay safe, get vaccinated. For time being, wear your mask. Thank you. If you have any question at this point, we could entertain some questions.
You mentioned Fort Bend County's vaccination rate of 66% for people 12 and over. That's much higher than the surrounding counties in the area. What do you attribute to that very high number here compared to other places?
Because we took from day one COVID as a serious matter. And we invested so much time, so much our resources, and like everyone you see behind me contributed to make that happen. And we mentioned about our nonprofit organizations, and every stakeholder we can talk to, we can communicate and coordinate, and we worked with everybody. And so, as you know, when you're trying to reach out to 860,000 people, and it is definitely it takes a village. And so we went with maybe a village, and that's the reason why we are where we are today. And and along with that, we will continue to do this effort because we don't want to slow down because COVID is here. COVID Delta variants and other definitions of COVID are here. So we will continue that effort. That's why we brought all this, our leaders, and we will be communicating with our community leaders also. And the end result is we were able to get a high percentage in Fort Bend County.
With the mask, with the county so vaccinated, why are you asking residents who are vaccinated to wear masks indoors? I mean, if they are protected from the Delta variant, what is the reasoning for doing so, and why should they wear masks indoors?
Because one thing I will give more scientific. Would you please go ahead and answer that? I could answer it, but you could put it in the eloquent way, scientific way. Please go ahead.
Sure. That's a great question, and a lot of people are asking that same question right now. So what we've said is that if you are fully vaccinated, you are protected from the virus in general. Right now, what we're noticing is that because the Delta variant is so widespread through the community, it'll take time to see if, with more numbers of people that are infected, if that vaccine, is able to hold. That's just we don't know that yet. And we also know that there's a segment of the population that will not be able to be vaccinated. Vaccines are not 100%, so there's still a percentage of people that won't be protected even if they take that vaccine. It's a small percentage, but it's still a percentage, and a bigger number means more people.
But it seems like, again, when people went the effort, this county and their community took the effort to get vaccinated, to get back to work, to not to wear the mask, and it seems like this is almost like here we go again, wearing masks again, even though I'm vaccinated and protected. What do you try to assure those people to say that this is just for the good of the community? It
absolutely is the good of our neighbors and our friends and those who are not fully protected. There are people that will not get vaccinated, aren't able to be vaccinated, and we all have our children. Our children are not able to be vaccinated right now. Now, they may not have some of the same effects, but then they can still spread and potentially spread to someone who's older and may not be able to be protected.
Yeah. And Dr. Minter, I wanted to add there, and I mentioned I was in New York a few days ago, and one of my cousin's husband got sick. He is vaccinated. He is vaccinated. And so I don't think when it comes to Delta variants and all, you have protection, but you're not fully protected. And he got sick, and he's showing symptoms, but thankfully it is just like a flu. And we know that he's going to be okay. And so wearing a mask is a simple thing we could do to protect ourselves, because this is a proof of Delta variants doesn't care you have. But probably if he was wearing mask, maybe he wouldn't have to go through that problem. But my point is, there is always wearing a mask is one of the best practices for everybody, for us, people around us, our community. And so I believe we have a moral obligation to support that process.
We had another question.
Yeah.
George, just to follow up, you had mentioned a couple times the importance of telling your story, right, to overcome that hesitancy and to get people to want to take the vaccine. As you know, Fort Bend County is so diverse. There are so many people here who have family members all over the world, including in countries that have been hit very hard by the Delta variant, low access to vaccines. India is just one that comes to mind. Do you think that's a factor in getting people to really kind of like take this really seriously and maybe hits home a little bit more and get vaccinated?
Yeah. I tell you this. I talk to some of my relatives. I have friends in India. And I tell you this. They ask me, you mean to say you all are vaccinated? Those people are still standing in line to get their vaccine. And so we don't have, we just mentioned in the beginning, there is no line. And you just walk in and get, and what is the worst case can happen. And so absolutely it is important. But at the same time, I understand human beings, if they have any hesitancy, they have any issue with this. And that's why we wanted to provide them with information so that they could make their decision what is best for them. Thank you.
Thank you, Judge. I have another question. I was just wondering how the demand for vaccines has changed in the past couple of months. Has it slowed down in the county? And then secondly, in terms of the outreach that you mentioned and informing residents about the vaccine, who specifically are you kind of trying to reach, and then in what areas and in what ways are you informing people? So
first of all, like you said, we wanted to learn what is the need, first of all, and then can you repeat the first question?
Has the demand slowed for the vaccine?
Yeah, definitely. The more people get vaccinated, because as you know, we had at least 4 or 5 permanent locations. Then we have a mobile unit, and we are going to so many different places. There is a definite slowdown because a lot of people are already vaccinated. So definitely there is a slowdown. And talking about the outreach, it is simply to provide information. It is simply to provide information. And Dr. Minter, you wanted to elaborate what that exactly means, because there are some concerns out there, about the outreach. So would you clarify that? So thank you.
And I do want to just mention, when you had the question about demand, and the judge is absolutely right. A lot of people have vaccine already. But what we do notice is that when we go into targeted communities, there's a demand there. There are specific churches that we'll go to. If a priest, say, gives a call out and we're there on a Sunday during Mass, we can have 80, 90, 100 people that said, oh, I'm so glad you're here. Very glad you're here because I work early in the morning till very late at night. I don't shop at H-E-B. I don't shop at Walmart or places where you can get a vaccine easily. They may shop at the Dollar General and they don't have a pharmacy. They don't have regular care. So it's a different type of demand that certainly hasn't decreased. So I want to point that out as well. And outreach, of course, is going to be in those areas. Areas where people are not receiving vaccine, we're determining those areas. It's pretty easy to determine those areas just by looking at the numbers. We have health data analysts, and we partner with School of Public Health, and we are able to see locations of low vaccine rates and low vaccine uptake. And also, we can overlay those by areas where we've had a big impact from COVID disease. And so those are the areas where we can reach out to community leaders We can find out the ways people want to be communicated with. And once we determine the ways they want to be communicated with, maybe our message will get there better and faster, and we'll be able to at least give them the right information to make the choices they want to make about their health.
Dr. Minner, just one more question. Because this county has been so vaccinated so much and is almost at a herd immunity, do you think that this period of wearing masks indoors and all these other procedures that you're doing, would that be a shorter amount of time than you think, depending on the vaccine, how many people more take the vaccine and how the Delta variant acts?
We certainly hope so. What we've seen throughout this pandemic is that our behavior affects the outcomes. Our behavior affects the outcomes. Our behavior affects the outcomes. And so we've watched, and we know there's a 10 to 21 day lag between the time that we see the results of our behavior. And so I hope that that is the case. Thank you.
Thank you so much.